Well, thank you, Anthony. People have been telling us right through this campaign that for them it's never been harder or more expensive to see a doctor after almost 10 years of cuts and neglect to Medicare from this government. Patients are crying out for better access to a doctor and better treatment options, particularly for complex chronic disease. Now, over the last few years, doctors groups, nurses, allied health groups and importantly patient groups have worked hard to develop a plan to strengthen Medicare, to deal with many of the issues Emma was talking to us about, the need to strengthen that relationship between a GP and a multidisciplinary team on the one hand, and particularly patients with more complex chronic disease on the other, a 10-year plan for primary care, GP practices like this and others across the country. But Scott Morrison has left those groups high and dry. He committed $450 million to the implementation of that plan back in 2019 and then cut his own funding, because that's what they do to Medicare. They cut the funding. And in this year's budget, there was absolutely nothing around the implementation of this important plan to improve primary care, other than apparently $500,000 for governance, whatever that means. Classic Scott Morrison. A big announcement about this 60-page plan and nothing to deliver it, nothing to actually make it happen. Well, we will deliver the change that patients need to strengthen Medicare and particularly to improve primary care. We'll have better access for patients, particularly after hours with their own GPs. We'll have better care options, as I said, particularly for patients with complex chronic disease. And we'll do that through the Strengthening Medicare Fund that Anthony is announcing today, a commitment of $750 million over the forward estimates to implement the key priorities that doctors, nurses, allied health groups and importantly patient groups have said that Medicare needs immediately. And we'll do that through a task force that will report by the end of this year, including those sorts of groups, to make sure that we get those priorities right and we deliver the change that patients and medical groups need. Also, as Anthony has said, we're delivering grants to support and strengthen general practice. They have done it tough over the last several years, after almost a decade of constant cuts from this government. But as Anthony said, in spite of all that, they stepped up magnificently to keep us safe, to keep us healthy over the course of this pandemic, with no additional support to put in place the additional infrastructure they needed for COVID, for telehealth and those sorts of things. And as Anthony said, Australian GPs need more than our thanks. They need real support to strengthen their practice, to improve patient access, and we will give them that support through $220 million of grants to improve patient access, to help them upgrade IT equipment, to deliver telehealth, to change their practices, to improve and expand patient access, to upgrade their equipment and things like that. Only Labor has a plan to strengthen Medicare as well as to cut the price of medicines.